Good morning, everyone. Myself Aisha. As we are today celebrating workshop on administration of medication, I am from Station 1 and I am going to demonstrate the oral medication procedure. Next, let's see the definition. Oral medication refers to the administration of drugs through the mouth where it is swallowed and digested in the gastrointestinal tract. We can provide the tablets and capsules. For example, we can provide paracetamol like this. Yes, ma'am. We can provide like that tablets. Next, we can provide liquid syrup. For example, we are having salbutamol. This is for bronchodilator, and we are having terbutaline, which is also for bronchodilators. For removing the cough expected sputum removal. Next, we have powders. In powders, we can provide ORS. Next, we are having suspensions. Suspensions means it is like syrup. In syrup, small drug liquid, small solid particles will present. For example, we can provide antacids or pediatric formulations. And next, we can provide sublingual. Sublingual means we have to provide below the tongue. For example, nitrogen glyceride tablets or vitamin B12 tablets. Next, we can provide buccal. Buccal means we have to provide between the gums and cheeks. For example, sublingual below the tongue. Next, for example, we can provide buccal means strepsils. Next, we are having one scenario. Mr. Sanjay Verma, he is 45 years old. He came with viral fever since 5 days. Next, let's check the availability of articles. We are having a clean tray containing gloves for maintaining hygiene. Next, we are having kidney tray to discard the waste. We are having towel or gauze piece for wiping the mouth. We are having mortar and pestle to crush the medication. Next, we are having measuring cup, spoon, syringe, and dropper to measure the medication. Next, we are having medications and a glass with water for easy swallowing. Next, confirm the patient identity by checking the name tag. The patient is Sanjay Verma. Next, check the administration what doctor is prescribed and check the right dose. After checking the dose, we have first to explain the procedure to the patient. Good morning, Miss Sanjay Verma. How are you feeling now? Did you had your breakfast? When you had? Okay, I am going to give the oral medications as the doctor prescribed. Please cooperate with me. If patient is telling he is not taken breakfast and food, we have to tell the patient to take the food. And if the patient is took food and before the 5 minutes, we have to come after the 10 minutes to give the medication. Next, tell the patient to sit in upright position. Here the patient we are having dummy, so we have to give the position by elevating the head. Before doing the procedure, remove all jewelry and wash the hands and wear the gloves. And next take the medication. Next take the medication. First give the water to the patient. Either you are able to swallow or I can give the medication in crush. No problem. I will give the medication crushing and you can easily swallow. Take the medication and put in a paste mortar and next crush the medication. After crushing the medication, take in a spoon and add 2 drops of water. Offer the water to the patient. Next, give the medication. After providing the medication, give the water. Take the towel and wipe the face. After completing the procedure, take the MAR chart and write this is the MAR chart. MAR chart, in this we have a patient name, we have to write patient name, next we have to write the age of the patient. This is the MAR chart. We have to write here patient name, here age we have to write, here sex, and next weight of the patient, here IP number. Next, any allergy is there by taking that medication. If any allergy is there, we have to write that, and diagnosis we have to write, and we have to write here date. When we given the tablet, we have to write the time. Next, we have to write the time. Here, on which time we given the medication, we have to write the time. Next, medication, which medication we have given. Next, we have to write dose. Or next we have route. In which route we given. For example, I given it through orally, I have to write oral. Next, frequency. How much frequency is given? For example, if you are giving once in a day means you have to write OD. If you are giving 2 times in a day means you have to write BD. If you are giving 3 times in a day means we have to write TD. In for reason, we have to write reason for what you are giving that medication. For example, you are giving means fever means you have to write here fever. Next, given by who are giving, nurses. That who are giving, you have to do your name, your signature and name. Next, you have remarks. If after giving the medication, if any allergy, any symptoms you see means you have to write. Or nothing means you have to write. For example, I will written. Before when the patient is came, the patient is having 100 degree Fahrenheit fever. Now the fever is reduced to the 98 degree Fahrenheit. We have to do the signature here. Provide comfortable position to the patient. Remove the gloves. First, before removing the gloves, if the any recyclable item is there in that, we have to replace the articles. If we replace the recyclable item is there, we have to wash and soak, and any discarded item is there, we have to discard in a right bin. Yes, ma'am. Buccal means we have to provide between gums and cheeks. Sublingual means we have to provide below the tongue. Yes, tablets, inside the tablets we have to discard in yellow bin. The wrappers we have to discard in green bin. Next, bottle is, if it is empty, we have to discard in green bin. If it is inside syrup is there, we have to discard in yellow bin. Syringe also we have to discard in green bin. Plastic. No problem. Take acid and ready to accept. You have to think and correct that. Red bin we have to discard.